everyone, and welcome back to my channel. My name is Bethany if you're new here, and we are officially in the home stretch. It's baby month and baby is gonna be here in less than 3 weeks. Wow, it's crazy. So now that I am currently 36 weeks pregnant and I'm going to be officially having my baby in 3 weeks, I'm gonna be going through how baby's doing, how I'm doing, some of my symptoms, things that I'm going through, and then I'm gonna be talking a bit about my care and some things that have kind of changed with that too. I feel like things are changing a lot, but that's okay. One thing before we get started, if you are wanting to follow along with me on a daily basis, I highly recommend you guys follow me on Instagram. That is where you're gonna get the first peek of baby, is over on my Instagram. So if you're not following me on there already, I would highly recommend that you do, because I know you're not gonna wanna miss out on that, because after baby comes, I'm not gonna be posting a video or the birth vlog like right away. I'm gonna be taking some time to get used to baby and all that stuff. So you're gonna definitely wanna stay up to date with me on my Instagram, especially in this last few weeks. So go over there, follow me on there. You guys will definitely wanna do that. All right, so first I'm gonna talk about baby and how he is doing. If you don't know, I'm having another boy and I'm so excited. I have a daughter and a son, so it's gonna be super fun to add another boy to the family. Currently he is around 6 pounds and is the size of a honeydew melon, I think. So anyway, he's doing really good. He's kicking a lot still. There are definitely moments within the day that he is more active than others. One of those times is definitely at like 11 at night, and then also at like 6:30 a.m. He basically wakes up at that time every single morning. So I really can't sleep past that time, which is totally fine. But I am just really enjoying these last few weeks of his movements, even though sometimes they really hurt me. And I'll get into that in a second. But I know that I'm gonna miss the movements. I'm gonna miss feeling connected to him in that way. So I'm just trying to cherish it, even though it, yeah, like I said, it can be uncomfortable. All right, so baby is actually currently in the head down position, but since I'm having a scheduled C-section, it really doesn't matter what position he's in, but because of that, I've been feeling some discomfort, like I said, with his movements. One thing that was brought to my attention about him is that he has a lower heart rate. So his heart rate at my last midwife appointment, which was yesterday, was around 120 beats per minute. And it's on the lower side of normal, but I will be talking about this more as I talk about my care and my midwife appointment I had yesterday later in this video. So like I said, baby is doing well. He's moving lots. So I really don't have any concerns. He's doing good in there. And I can't wait to see his little face. I'm so excited to see what he's gonna look like. I feel like he's gonna look a lot like my son, Kellen. Definitely compared their ultrasounds pictures to each other, and they look very, very similar. So I would be shocked if he didn't look a lot like my other two kids. Okay, so now moving on to symptoms. So now that I am 9 months pregnant, things have become just, again, more uncomfortable. Even in my last pregnancy update, it's become more uncomfortable to walk, to sit, to really do anything, even to lay down. It's hard to get in a good position. So I just feel a lot of pressure. And then even when I'm laying down, sometimes I can't even lift my leg up because of the way he's laying, and it's just, he's running out of room in there. So I'm trying to enjoy this time and just be thankful that we made it to this point, which I really, really am. He is basically full term, and if he was born now, he would be okay, but we definitely want him to stay in there a little bit longer. So one thing that I am now doing is waddling. So since my son is head down, I have been waddling like everywhere when I walk. It's just a lot harder to move my body, and so I've been trying to rest as much as I can because chasing around 2 other kids has been challenging, especially being this pregnant. I've never done that before. I've never had 2 other kids and, been like 9 months pregnant. And so it takes a lot of energy out of me. So I've been trying to rest as much as I can, like sit down as much as I can. But like I said, any position just feels uncomfortable. So it's just that point in pregnancy where you're ready to have this baby. So another symptom that I've been having is itchy skin. Since your skin is stretching so much during pregnancy, it gets really itchy. And my belly has been a lot more itchy at during this time because again, baby is running out of room, and so my skin is very tight and very stretched out, which is totally normal. So I have been just putting a lot of lotion on, not to prevent stretch marks because it's not really going to do much, but just to moisturize the skin so it doesn't bother me as much. Then I also have an oil that I use on my belly, which really soothes my skin a lot. But it's not just me being itchy on my stomach, but also like all over my body, and mainly around my back area. It gets really itchy because I know things are still growing that way as well. So it's just part of pregnancy, but yeah, my skin has just been really irritated recently. Another symptom that I've still been having is heartburn. It's not as bad during the day, but it really gets really bad at nighttime. And so it's like, it's awful. Having acid reflux is just so annoying. And it's not fun at all. But one thing that I've been doing that has really helped with it is actually eating Freezies when I have heartburn. Like Tums are good and all that stuff, but I just found that eating Freezies or something that's kind of cold, or even just like chewing on some ice, really helps kind of subside the heartburn. So if you're dealing with it, maybe try that and see if that works for you too. Okay, so another symptom that I have been having is, I lost it. Well, one thing is that I'm still having pregnancy brain and forgetfulness, so that's still one that's still happening. I guess another one that's been happening is just clumsiness. Now that my belly is growing and has been growing, and it protrudes a lot more than it used to, I definitely am a lot more clumsy. I drop things more. I can't see my feet, and so I've stubbed my toes lots recently, and like just kind of being a bit klutzy because your center of gravity is totally different than when you're not pregnant. So now my belly has grown to the size that it has. It just has just thrown me off. So I'm definitely a lot more clumsy these days. All right, so moving on to my care. If you don't know, I have been seeing a midwife my entire pregnancy. She has done the majority of my care, like, you know, ordering all my blood work and going through all that stuff, going through the results of my anatomy scan, all that stuff. Like, she takes care of me like an OB would. But since I'm having a scheduled C-section, it's a little bit different where I do have to have an OB and go see him for one appointment to kind of go over my C-section, schedule it, and kind of go through everything. And if I have any questions, I can ask him. So he is the one who's going to be actually doing my surgery. But for all the prenatal and the postpartum care, my midwife will be doing. So if you're wondering how that kind of works with a scheduled C-section, that's what kind of works here as I live in Canada. So if you're curious, that's how it works. Anyway, so last week I had a midwife appointment, and unfortunately my midwife was actually on medical leave for about a month, and she came back but realized that she was no longer able to continue working, and it was a really incredibly hard decision for her, and I could see that it was just really hard. And unfortunately, the midwife office that I was at could no longer take me. They had no room to take on any of her patients, so I unfortunately had to be transferred to another midwife practice in the area. So I had to kind of do a bit of a mental shift there and just kind of accept it for what it was, because at this point it's like, well, there's nothing I can do about that. It's out of my control. And I really did feel bad for my midwife because she was really debating on whether to continue her work or not, but unfortunately she could not. So I am actually seeing another midwife for the birth and for postpartum, and I actually had an appointment with them yesterday, and they're great. They're all so amazing, so I really don't feel like that weird about it. It's just unfortunate it had to happen at the end of my pregnancy. Switching care at the end of your pregnancy is not ideal, but at the same time, like, I'm totally cool with it. It's not that big of a deal. And a lot of stuff about birth and all that stuff is just totally out of our control. So why would I get over emotional about things I cannot change? And that kind of goes along with what I said in my last pregnancy update, where I was a little bit frustrated about certain things. And if you want to go watch that video, you can. But overall, I'm doing a lot better with that information. And at the end of the day, it's just out of my control. And what I can control is my attitude and my perspective and how I deal with that. So overall, I'm feeling really good about birth and everything that's going to happen. I'm pretty positive I'm going to make it to my C-section date. But one thing that my midwife said to me yesterday at the appointment was that when she was taking the heart rate of the baby, she noticed that it was like on the low but normal side, like I mentioned earlier. Baby was sleeping when she was checking the heart rate, and so it was a little bit lower than what she was kind of, you know, wanting, but it was still normal. So it was about 120 beats per minute. So she wanted him to kind of react and kind of get his heart rate up a little bit. So she got him to move a little bit, and of course his heart rate increased a bit. So she was happy with that. But basically what she said is that if his heart rate ever went down to 110, that I would immediately have to go to the hospital and have a non-stress test and all that stuff. So she just basically told me to just keep an eye on his movements. And if he's moving lots, then there's really no concern. But it did kind of take me back a little bit, because I was like, oh my goodness, like this could be an issue. And so I've just been really trying to take it easy this last little while, and it just kind of proves to me that like I need to be taking care of myself really well this time, and resting lots and doing what I can to make sure baby stays in there as long as he needs to. This is my second last pregnancy update. I have one more, and then that's it. Then baby boy is going to be here. It's so crazy. So I am so excited, you guys. Like, I cannot say that enough. And one thing that I have just been feeling so much at peace recently about everything. I'm just feeling so good about how things are gonna go for birth and for postpartum. And it's just incredible how I've just felt such a different perspective this time than I did with my son, where things were just not as stable, and I was feeling a lot of anxiety. And so this time I'm just feeling so at peace, and it's just been really, really great. So feeling excited, feeling good about things, ready to embrace birth and postpartum, and just kind of go through it all. Anyway, that is where I'm gonna end the video. I hope you guys found this video helpful. Again, so excited to welcome baby boy here. And it just, I'm just so excited. So anyway, thank you guys again so much for watching, and we'll see you guys in my next one. Bye guys.